Hi, my name is Rick Blum. I've been asked to give a short discussion on how to use the eBNF for the PSA examination. This talk will take about 15-20 minutes. I'm just going to remind you about the location of the two different eBNFs, remind you to practice looking up common types of questions when arising in the PSF, and I'll show you some of the useful functionality of the current two types of eBNF. Also at the end, I'll remind you to go to the PSA website itself, as they have a list of FAQs and advice videos on the different items that come up on the PSA and how best to approach those. In terms of the eBNF, here's the link at the bottom here to the New Medicines Complete eBNF. Now that Medicines Complete requires a subscription, so if your institution doesn't subscribe, you won't be able to practice with the New Medicines Complete website until you're in the exam. That said, if you're in the UK in particular, you've access to the NICE website, which is free from home, doesn't have to be in an institution. NICE provides a free version of the BNF. Again, if you click on the below link, it'll take you there, and there's both the BNF and the BNF for children on the tab across the top of the web page. You can either use the top search engine for the NICE BNF, or you can go into treatment summaries, which you can also do in Medicines Complete. These are useful if you're aware of the diagnosis, which would be common in the PSA. You know that you're told that the patient has the likes of asthma or angina, and you then search under those treatment summary terms to come up with your answer. You can go into the treatment summaries by list, and it's alphabetized. A lot of people tend to just type the search engine, type in acute asthma, or type in asthma, and go and look for the acute branch. One thing different about the eBNF, for example, if you type in meningitis just into the search engine, has a tendency to produce the drug answers, which then requires you to know which drug you're planning to use. The Medicines Complete eBNF have done some work on their intuitive search engine, and you can type in the likes of meningitis, and it'll quickly on the first search engine results page give you your two options. Be careful though, it often will give you the BNF for children answer first above the BNF for adults. And if you're patients and adults, it's important to click on the correct link to the correct BNF. When you do click on that link, remember that the questions in the PSA are context dependent. So here the top arrow shows that you would give benzalpenicillin if you're out of hospital pre-transfer, but it also then tells you about priorities and other issues when you're in hospital. So it's important when you're reading the question to see what the context is. Is the patient in the emergency department, in which case you've got access to everything you need, or is the patient somewhere else where you may be limited access to the likes of intravenous therapies and that kind of thing. If you do type in a diagnostic search request such as gout, it's important to select whether you want acute gout treatment or are you looking for long-term gout prophylaxis. A lot of search terms like asthma, angina, gout, etc. It's important you click on whether it's acute or chronic so that you get the right answer. Things that you use to prevent exacerbations occurring are different to the acute management of exacerbations of any given condition. When you are on the correct page or treatment summary, you can also use the Control F search function or find function. And it's, for example, it says in your past medical history, your gout patient has heart failure. You can Control F and type in heart failure, and it will highlight within the body of text a relevant statement in and around heart failure. about acute attacks of gout, and this may be useful for you if you're not sure how having heart failure affects your treatment choice. And again, you can do that for other drugs or past medical conditions. If you're told in the body of the question information, it's 99% of a chance it's going to influence your drug treatment choice in the exam. Most commonly, you're going to just type in a drug name. For example, I've put in indapamide here. And when you're at the top of the drug monograph, you have a subsections list here where you can look up cautions, interactions, side effects, etc. Important there, you've got renal and hepatic impairment or pregnancy, depending on your patient's circumstance. You also have monitoring requirements, which can be useful for the therapeutic drug monitoring questions, which we'll come to later. So you can use the subsections hyperlinks if you wish. Just click on them, they'll take you to the relevant part of the indapamide pages. Alternatively, if you're not sure whether the information you're looking for comes under cautions or side effects or patient information, you can use the Control F find function, so pressing the Control button with the F key and typing in the query that you have or the drug that you're wondering about the interaction, etc. And you might come across, it will highlight that relevant piece of information somewhere in the drug monologue or monograph. So again, if you're in the interactions section, which can be part of the PSA, you can go to indapamide, click on the interactions for indapamide on that page. And when you're on the alphabetically list drug interactions, you can again use Control F find function. You don't have to type in the full name of the various other drugs the patient may be on. Just usually need to type in the first 3 or 4 letters. Here the example is I've given diclofenac, and by the time I've written in DIC, the diclofenac flashes up as a severe interaction with indapamide, and that might be relevant to the question you're looking at. When you come to the side effects side, and again we do adverse drug reactions as one of the questions. These are now listed as common or very common, rare or very rare, uncommon, or frequency unknown. And it's the frequency unknown section you have to be careful with here. Frequency unknown contains common and rare adverse effects. The actual numerical frequency is not known, but doesn't mean it's not common. So be careful of that. Also, side effects may be specific to just that one drug within class, or it can be a class-related side effect. And the side effects are listed as class effects first, followed by other effects for that specific drug that you've been interested in. So be careful to check both paragraphs. When it comes to monitoring, you can obviously select the subsection for monitoring, but sometimes the monitoring requirements aren't there, or specifically what you've been asked about in the question may not be there. So you can look there first. An alternative approach is to actually look in some of the other sections. This is a wee bit labor intensive. You'll notice here that if you're looking up digoxin within the cautions section, it will tell you to monitor serum electrolytes, but it doesn't tell you what electrolytes you'd be interested in. You do require to bring some clinical knowledge to the exam. Again, sometimes the safety and medicines boxes contain the information you're looking for, but you'll notice I've done a Control F function here, and by typing in monitoring, it's highlighted the area. However, I would be better off typing in just monitor, and that may bring up other elements around monitoring, but by using the shorter version of the word, I don't miss the other elements that I'm looking for. All just clues to how to use the eBNF. The other thing to remember from this talk is the PSA has its own website. On that website, they have a link to informational videos. And there's a good list of information and videos, including their own video on using the British National Formula, the BNF, along with other frequently asked questions and videos about the interactive face of the actual online exam itself. With regards to the PSA, I do wish you the best of luck. If you have further questions based on the materials we've provided on behalf of NIMDA, you can contact me directly on that email. Okay.